Now, Ghana is set to have regional isolation centers in about a fortnight to help screen suspected cases of Ebola in the country. Acting Director of the Public Health Directorate, Dr. Bedu Sarkodie, told journalists on Monday, although 37 suspected cases recorded throughout the country have all proven negative, the move forms part of precautionary measures to keep Ghana safe from the Ebola virus. He spoke to the media after a meeting by the Interministerial Action Group at the Flagstaff House on Monday. We'll go back to that story and bring you the details, but for now, let's take this one because the blood samples of 3 persons quarantined at the Nsawam Government Hospital has tested negative for the Ebola virus. Medical officer at the hospital, Dr. Prince Vaness, who confirmed this to Joy News, says the facility is still intensifying its precautionary measures to deal with any outbreak there.
The 3 suspected patients, a 16-year-old girl, a 56-year-old known alcoholic, and a 53-year-old long-distance driver, reported to the Nsawam Government Hospital last week with blood disorders. Their blood samples, which were sent to the Noguchi Memorial Institute for Medical Research for further examination, proved, however, negative.
And the samples were taken, they were sent to Noguchi, and luckily for us, we got results yesterday in the evening that the samples had tested negative for both Ebola and then Marburg, which is also another hemorrhagic fever that looks like Ebola. So now everything can be laid to rest, even though we are still keeping our surveillance inactive.
According to Dr. Vaness, all 3 patients are responding very well to treatment.
Okay, for now, the 16-year-old was being managed for intravascular hemolysis secondary to severe malaria. The urine has cleared, she's better and may probably be discharged later today. The second man, who is the alcoholic that we mentioned, he was also being managed as an upper gastrointestinal bleed secondary to liver disease. He's doing well. We'll conclude our investigations, but he's better now. And when we put everything together, he may also be discharged later today. We still have the third man who still has dark urine, but is also responding to treatment. He's better than he came in, and he even wanted to go home today, but we need to make sure that everything is well done before he goes. So they are all doing well now.
Meanwhile, a virologist at the Noguchi Memorial Institute, Dr. J.H. Kofiboni, says test results of the suspected Ebola case from Boko also proved negative.
Yeah, we did the test and it's also negative. It was not positive. Yeah. If you talk about the symptoms of Ebola, the initial symptoms are very unspecific. It mimics a lot of other disease conditions that we have in the country. So if you are not sure, why don't you try and pick the sample and go and rule it out that we don't have, this one is not Ebola, even though the symptoms are Ebola-like.
He added, between April and August 2014, the institute has conducted tests on over 20 suspected Ebola cases in the country.
I've been receiving samples. I can tell you that since the first sample received was in April, since then we have been receiving samples, and we've got well over 20 samples from different parts of the country. The north, the middle belt, and the south. We receive, they suspect, because of the awareness that have been created, anything that they see that look like Ebola-like symptoms, they quickly pick the sample and they bring it to us.
He encouraged all health facilities to report to the institute whenever they receive patients with symptoms or traces of the deadly Ebola virus. Matilda Pomaga for Joy News, Accra.